Hey everyone, this is Dan Spencer of the Bellingham Board of Selectmen. Today is Wednesday, April 8th. Doing our broadcast to give you the latest, greatest updates and most accurate information with regards to the coronavirus, how it's affecting the town and its residents. As always, we start off with Deputy Chief Mark Porter.
Good morning. Thank you for attending today's meeting. Massachusetts currently has, as of yesterday, 15,202 positive cases with 356 total deaths. The U.S. has 401,636 cases with 12,839 deaths reported. I will get to the bottom of this right away, so we don't have to go back to me. If you do have any questions or concerns about COVID in the state of Massachusetts, you can dial 211. And if you have any questions or concerns in regards to your workplace, you can call the Massachusetts Attorney General at 617-727-3465. Thank you.
Thank you very much, Mark. All right, we will go to our public health nurse, Esther Martone, for an update.
Good morning. We had one new case come in overnight, so we are up to 23 confirmed cases in town. We do have 10 cases that have fully recovered, and we are up to a total of 129 Bellingham residents that have been tested.
And Esther, just to clarify, so out of the 23 tested positive, 10 have recovered, so now we're down to 13 active, is that?
That is correct.
Okay, perfect. All right. Bruce, Board of Health?
Good morning, everybody. Our board met last night, and I've been charged with the responsibility of taking the three different aspects that Governor Baker handed down: the stay-at-home policy, the quarantine, and the isolation. We are going to take the state's documents and incorporate it into our town bylaw or rules, which now makes it enforceable. So if you want to continue to be difficult, we're going to start to issue fines on that. I just want to make everybody aware that, you know, it's all for your own good, but if you're going to be trouble, we're going to retaliate now.
Good,
Yeah, while Bruce is here, not exactly related to COVID-19, but I know the Board of Health has been gearing up for the 50th anniversary of Earth Day, and this is the month for Earth Day. I think the actual day is that we're going to be observing as far as cleanup, and you're going to be looking for some cleanup efforts kind of by neighborhood. Is that right?
Yeah, absolutely. We may turn around and make it a cleanup week, or maybe activities throughout the month. We're having T-shirts printed, and if you out there and you're cleaning up, take some pictures. We want to put it on our social media, but we'll send whoever's on with a picture, we'll send them a T-shirt for their efforts. It's a ongoing problem. Everybody's seen some of the postings on there that, you know, we need to make it an effort to keep things clean. I know it's a pet project of many people based on the posts on Facebook. So, you know, I appreciate anybody's effort that they can put forward in cleaning up, and we reward the first 50 to 100 people with shirts. So let's see what we can do. We'll clean it up.
Excellent. Thanks, Bruce.
So details to be followed with as the days go by, and once they have something firmly in place, we'll.
Yeah, no, very shortly.
Okay.
And just so that other people may know that are listening in, this will be followed by other towns that are local that I've been in contact with: Medway, Milford, Franklin. So I mean, this is not something that's just going to be Bellingham. It's going to be supported by my brethren and sisters in the surrounding towns, because this is an ongoing problem that they're all dealing with.
Great, thank you very much. So as always, we like to field questions from the residents that email to covid19@bellinghamma.org. And we encourage you to send any questions, concerns, comments you may have, and we will address them as quickly as possible. That being said,
We do have a few questions, but Mary, could we swing over to our chart for just a second? We show this every day, and it kind of, a few people suggested we bring it up. It's not the most sophisticated chart, but it gives the message. I think it shows, if you look at it on April 3rd, we had 14 positive cases. Today, on April 8th, 5 days later, we have 23 positive cases. So, you know, it's out there, it's in our community, and we can't emphasize enough the importance of social distancing, observing the stay at home to the extent you can, and when you're going out to take out food, or you're going to a restaurant to pick something up, there shouldn't be any congregating there. And people in Bellingham have done a phenomenal job as far as that's concerned. I know Bruce has said it as well, that the spirit of cooperation in town has just been phenomenal. There's always going to be a few instances where we need to remind people, but it's just been incredible what's been going on as far as people trying to do what we're asking them to do. And I think Bellingham's done a phenomenal job. A couple of quick things to bring up before we get to the questions. The code red is going out this morning just to remind residents that the recycling center is open for yard waste only Tuesday, Wednesday, and Thursday from 9 a.m. to 2 p.m. So yard waste Tuesday, Wednesday, and Thursday. The rest of the center isn't open, so just yard waste. Bulky item collections, mentioned it yesterday, we're going to have to discontinue that effective today. It's only temporary. So as soon as it's safe for the drivers to get out of the trucks and be picking things up, again, they will be, as you know, we have automated collection. It's not going to affect trash or recycling. The bulky items will cease, and we mentioned yesterday too, Norfolk County mosquito control. A concern this time of year when they see the low-flying aircraft in town, they'll be spraying, and Triple E's the next thing we'll be worrying about, so they'll be out there spraying. Going right to our questions. Esther, our public health nurse, are you able to tell us the takeout restaurant providers that become positive for the virus? And I know people have seen that there have been reports. There was a report today that certain grocery stores had individuals test positive, but I'm sure that's just people volunteering that information. It's not something we can give out, correct?
That is correct. As I've said before, if you have been exposed to a positive case, you will be notified.
Okay. How does the virus respond to food items? And particularly food items, or as well as food items that can be put in the freezer? Another question that we've had before that's come up again.
Sure. Again, the recommendation is if you are purchasing items that need to be refrigerated or frozen, then you should wash those exterior packages down with a little mild soapy water and rinse it off, pat them dry, and then place them in the fridge and freezer, and they should be fine.
Excellent. Another question, does everyone get tested in Massachusetts if they have a low-grade fever or cough? Where would you go to get tested?
So the testing criteria to date is you do need to have a fever, you do need to have some of the symptoms, but you also need to have a doctor's order. So your first line of communication should be with your primary care provider. You should place a call to them and let them know what you have been experiencing, and then they will determine whether or not you will qualify for the testing and let you know where to go at that point.
Great. And just, we had a very positive one received. Just wanted to say thanks to all your hard work and diligence in helping our community. To talk about everyone, the first responders and the local emergency planning group, helping in keeping our community safe in these very challenging times. And then they go on to offer their support and assistance to the community. So we've gotten quite a few from people that are just volunteering and offering to help however they can, and a lot of positive messages, especially to our first responders. So we can't tell everyone how much we appreciate them. Nobody expects something like this to come up, and when it does, it's nice to see the men and women of the public safety step right up and do what needs to get done. Just a few reminders: the ball fields, of course, are closed. The playgrounds are closed. We ask people to observe social distancing, and you really can't do that when 5 or 6 people are out playing basketball. We've had a few reports of some of the private developments, condominium associations, where groups of people are congregating to play basketball. And it's just not safe right now. It's the quickest way to spread the virus. So we ask people to continue being patient with that. And we all look forward to the months ahead when it warms up and we can be outside doing whatever the heck we want to do.
And just to kind of elaborate on that, people will say, playing basketball, we're maintaining social distance while we're playing basketball. However, if there's 5 people using the same basketball, that basketball could be transmitting the disease as well. So that's why, it sounds a little crazy that, you're outdoors. That's the reason why we ask that you refrain from those type of activities.
Thank you.
Anyone have anything else?
Like Dan said, everybody thinks it's person-to-person contact. Well, it can also be person-to-surface contact. If an affected person touches the surface, that surface is contaminated and can spread the disease just as well. So we need to pay attention. If you're a restaurant or a provider, keep in mind that, if you're people that come through the door, you want to wipe these surfaces down, contacts, counters, any place where multiple people, like a keypad for your register. I mean, these are all areas that need to be frequently cleaned and sanitized.
Great, thank you. So as you may have noticed, periodically we have guests coming in from the community, whether it's retailers or grocery stores. If you have any special requests to have people come in to kind of educate yourself as well as us as far as what the common practices are for various locations in town, again, please use the email covid19@bellinghamma.org, and we will do our best to get those folks in to address any concerns you have. Other than that, pretty short update today.
We are looking at some guests later this week,
There we go.
potentially.
All right. So just remind everyone, maintain social distances, sanitize all hard surfaces, wash your hands. Thank you very much. Have a great day.
Thank you.